Before we begin today, I want you to take a brief moment and reflect on something that most people rarely question when it comes to their health. What if some of the medical tests you've always believed were essential after the age of 70 are not always necessary? And even more importantly, what if in certain situations, those same tests could actually introduce risks that no one has clearly explained to you? For many people, that idea feels uncomfortable at first because we've been conditioned to believe that more screening automatically means more safety. We've been told for years that catching problems early is always the smartest move, that following every recommendation is the responsible path. And in many cases, that belief holds true. But what almost no one talks about is that there comes a point, usually later in life, when the rules quietly begin to change. Not in a dramatic or obvious way, but in a subtle shift that can have real consequences if you're not aware of it. My name is Dr. Kelly Robbins. I'm an internal medicine physician and a geriatric specialist, and for more than 20 years, I've worked closely with patients in their 70s, 80s, and beyond. Over that time, I've had the privilege of seeing what truly supports healthy aging in real life, not just in theory. I've seen people remain strong, independent, and mentally sharp well into advanced age. But I've also witnessed something that isn't talked about nearly enough. I've seen individuals who are doing perfectly fine walk into routine medical appointments and leave on a completely different trajectory, not because they were sick, but because a series of well-intentioned decisions set off a chain reaction. A test led to another test, which led to a procedure, which led to complications, and before they realized it, their quality of life had changed in ways they never expected. If you've ever gone to a doctor feeling completely fine and somehow left feeling uncertain or worried, then you already understand how powerful that shift can be. That moment when you begin to question your own health, even without symptoms, is often where this entire process begins. Modern medicine doesn't just respond to illness, it actively searches for potential problems. And sometimes, it continues searching even when there is nothing meaningful to find. Within the medical community, there is an ongoing discussion that most people never hear about, and it revolves around a simple but important question. Are we sometimes doing too much, especially when it comes to older adults? Because there are certain tests that have become so routine that they are rarely questioned anymore. Once you reach a certain age, they are presented almost automatically, as if they are simply the next step you are expected to take. To understand why this matters, imagine a very common situation. A 73-year-old individual walks into a clinic for a routine checkup. They feel fine. They're active, independent, and managing their daily life without major issues. They expect a normal visit, maybe a few routine discussions, and then to go home. But by the end of the appointment, they are handed a list of recommended tests: a colonoscopy, a prostate screening, a cardiac evaluation. Suddenly, something shifts. Even though nothing has changed physically, their perception changes. They begin to wonder if something might be wrong, something they weren't aware of just an hour earlier. That shift from feeling healthy to feeling like a potential patient is one of the most powerful psychological effects of modern healthcare, and it often happens without us even realizing it. To understand why this happens, we need to look at how medical decision-making evolves with age. Screening tests are designed to detect diseases early, often before symptoms appear. In younger individuals, this approach can be extremely valuable because there is enough time for early detection to significantly change outcomes. The body is also more resilient, better able to handle procedures and recover quickly. But after the age of 70, several key factors begin to change. Many diseases, especially certain types of cancer, tend to develop and progress more slowly. Life expectancy becomes more individualized, meaning that two people at the same age can have very different health trajectories. And perhaps most importantly, the body becomes less tolerant of stress, whether that stress comes from invasive procedures, anesthesia, or recovery itself. When you combine these factors, the balance between benefit and risk begins to shift in a meaningful way. This means that a test that might provide clear benefits at age 50 could offer much less benefit and potentially more risk at age 75. However, in everyday medical practice, recommendations do not always fully reflect this shift. Many patients are still guided by general guidelines rather than individualized assessments, and that can lead to decisions that may not fully align with their specific situation. Let's take a closer look at one of the most commonly recommended procedures, colonoscopy. For many years, colonoscopy has been considered one of the most effective tools for detecting colorectal cancer. In the right context, it absolutely has value. It can identify early signs of disease and even prevent cancer by removing precancerous growths. But after the age of 75, the equation becomes more complex. Even the preparation for a colonoscopy can be physically demanding. It requires clearing the digestive system, which often leads to dehydration and electrolyte imbalances. For a younger person, this may be uncomfortable but manageable. For an older adult, it can place significant stress on the body, sometimes enough to cause dizziness, weakness, or even hospitalization. And that's before the procedure itself even begins. When you consider the procedure, there are additional risks to keep in mind. While generally safe, colonoscopy can lead to complications such as bleeding or perforation of the bowel. These risks are relatively low but increase with age. Sedation, which is commonly used during the procedure, can also place strain on the cardiovascular system, which may not tolerate it as well as it once did. Now, here is where the conversation becomes particularly important. Large-scale studies published in respected medical journals have examined the outcomes of routine colonoscopy in older adults. What they found was that for many individuals over 75, these procedures did not significantly extend life expectancy. In other words, they did not provide a clear survival benefit. At the same time, they were associated with a higher likelihood of complications that required hospitalization. This creates a situation where the potential risks may outweigh the potential benefits, especially for individuals who are otherwise healthy and not experiencing symptoms. And yet, despite this evidence, many patients continue to be encouraged to undergo routine colonoscopy simply because it has become part of standard practice. This doesn't happen because of bad intentions. Most healthcare providers genuinely want to help their patients and follow established guidelines. But the system itself often emphasizes consistency and routine, sometimes at the expense of personalization. As a result, patients may not always receive the full context needed to make a truly informed decision. And that is where awareness becomes so important. Because once you begin to understand how these decisions are made, you can start asking better questions. You can move from simply following recommendations to actively participating in your own healthcare choices. And this is exactly where the conversation becomes even more important, because the next test we're going to talk about is not just about the test itself. It's about what happens after the result. And in many cases, that's where the real impact begins. The second test, prostate cancer screening using the PSA test, may seem simple on the surface, but it opens the door to a much more complex chain of events, one that has affected millions of men without them fully understanding the consequences beforehand. When we consider PSA testing in older adults, the situation becomes increasingly complex. The PSA test, or prostate-specific antigen test, is a blood test designed to detect a protein produced by the prostate gland. Elevated PSA levels can signal the presence of prostate cancer, but the reality is that many non-cancerous factors can also influence these numbers. Conditions such as benign prostatic hyperplasia, Inflammation, recent medical procedures, or even minor infections can lead to higher readings. In younger men, early detection can sometimes provide a life-saving advantage. Detecting aggressive prostate cancers early can mean earlier intervention, potentially preventing progression and improving survival. However, once a man reaches 70 or beyond, the calculus changes dramatically. Research indicates that a significant proportion of men in this age bracket already harbor prostate cancer cells. Yet, the vast majority of these cancers are indolent. They grow so slowly that they are unlikely to ever cause symptoms, threaten health, or shorten life expectancy. This creates a critical dilemma. When a PSA test comes back abnormal in a 70-plus-year-old man, it almost invariably triggers a cascade of further investigations. Initial findings often lead to repeat blood tests, imaging studies such as MRI scans, and sometimes invasive procedures like biopsies. While these steps may seem prudent at first glance, each carries its own potential complications and stressors. Biopsies, though generally safe, can cause pain, bleeding, and infection. They can also provoke considerable anxiety while awaiting results, a period that can feel interminable and emotionally taxing. The complexity grows further when a cancer diagnosis is confirmed. In many cases, older men face the prospect of treatments such as surgery, radiation therapy, or hormone therapy. These interventions are far from benign. Surgery can lead to urinary incontinence and erectile dysfunction. Radiation can result in fatigue, bladder irritation, or bowel changes. Hormone therapies can alter mood, energy levels, and even bone density over time. The paradox is stark for many older men. The treatment itself may introduce far greater harm than the cancer ever would have caused. Living an active, independent life can suddenly be overshadowed by ongoing medical interventions, lifestyle limitations, and the psychological burden of managing treatment-related side effects. This phenomenon, known in medical literature as overdiagnosis and overtreatment, is one of the most misunderstood and underdiscussed issues in modern medicine. Many patients assume that detecting a condition is inherently beneficial without realizing that context, age, overall health, and disease progression is absolutely critical. The emotional impact of this situation cannot be overstated. Imagine a man who has spent 75 years building a life filled with purpose, hobbies, family, and independence. He schedules what seems like a routine blood test and is suddenly thrust into a whirlwind of follow-up appointments, invasive procedures, and complex treatment decisions. Anxiety sets in. Sleep suffers. Daily life is disrupted. The irony is that in many cases, nothing would have happened if the abnormal test had never been performed. Yet the system often defaults to action rather than careful observation. Both patients and doctors can feel compelled to intervene, even when monitoring or conservative management might be the wiser, safer choice. Now, let us turn our attention to the third test, which in many ways illustrates the dangers of overscreening most vividly: aggressive cardiac stress testing in asymptomatic older adults. At first glance, this approach seems logical. Cardiovascular disease is a leading cause of mortality worldwide, and identifying heart issues before they manifest symptoms appears prudent. But the nuance is essential. These tests are often administered to patients who exhibit no signs of heart disease, no chest pain, no shortness of breath, no history of cardiac events. Essentially, these are healthy, active individuals being subjected to a diagnostic procedure that may not be necessary. The problem lies in what medical professionals call false positives. A cardiac stress test may suggest a potential abnormality even when no significant disease exists. Once this occurs, the cascade of further testing and interventions is nearly inevitable. Additional imaging, such as echocardiograms or coronary angiography, may follow. In some cases, stents or even bypass surgery are recommended. Each step in this sequence carries risks. Angiograms, though generally safe, involve threading a catheter through arteries, which can cause bleeding, infection, or arterial damage. Stents, while life-saving in patients with true blockages, require lifelong medications to prevent clot formation and introduce their own procedural risks. This cascade, often called the cascade of care, can be more accurately described as a cascade of harm in older adults, particularly when the initial test was performed on someone without symptoms. Research confirms that aggressive interventions for stable, asymptomatic patients do not always improve outcomes. Several studies have demonstrated that stents or bypass procedures in older adults without significant cardiac symptoms do not provide a meaningful survival advantage compared to conservative approaches such as lifestyle modification, medication management, and regular monitoring. Yet the psychological and systemic pressure to act is powerful. Patients feel compelled to respond, fearing that inaction equates to negligence. Physicians, guided by protocols and the desire to preempt complications, often recommend intervention. And the healthcare system, incentivized in many regions to perform procedures, reinforces this dynamic. To illustrate these concepts more vividly, let me return to Margaret's story. When she came to see me at 74, she was an active, independent woman with no significant health issues. During her checkup, she had been advised by her previous physician to undergo a colonoscopy, PSA testing, and cardiac stress testing. Margaret paused. She did not reject medical advice out of distrust. She simply wanted to understand the necessity and potential consequences. She asked a simple but profound question: what happens if I don't do these right now? That question marked a turning point. Instead of immediately proceeding with the recommended tests, we reviewed her overall health, daily routines, and personal priorities. Together, we evaluated risks and benefits in the context of her age, activity level, and goals for quality of life. Margaret made intentional choices. She adopted daily walking routines for cardiovascular support, focused on balanced meals with lean proteins and colorful vegetables, and strengthened her social connections through family and community activities. Over time, she noticed improved energy, mood, and physical function. Importantly, she avoided the stress, complications, and lifestyle disruption that might have resulted from unnecessary testing and treatment. 5 years later, Margaret remains independent, physically active, and fully engaged with her life, illustrating the profound benefits of informed, patient-centered decision-making. Contrast this with the experiences of her friends, who accepted routine recommendations without question. One underwent a colonoscopy that led to complications requiring hospitalization. Another had a cardiac stress test that triggered further interventions, including stent placement and lifelong medication. Though both acted with the intention of preserving health, their quality of life suffered as a direct consequence of interventions that may not have been essential. These real-world examples underscore a critical truth: more intervention is not inherently better. Thoughtful assessment, individualized care, and a focus on meaningful outcomes often provide the best path for healthy aging. Research supports these observations. Large-scale analyses in journals such as JAMA and the New England Journal of Medicine indicate that the benefits of routine screenings often diminish with age, while the potential harms increase. This evidence highlights a tipping point, typically around 75, where the balance of risk and reward shifts. Recognizing this is crucial for patients who want to maintain health, independence, and a high quality of life. Initiatives like the Choosing Wisely campaign advocate for informed dialogue between patients and healthcare providers, emphasizing the importance of questioning tests and interventions that may not offer tangible benefits. The central message is simple but powerful. Not every test is automatically beneficial, and sometimes strategic restraint can lead to better health outcomes than immediate intervention. International comparisons reinforce this perspective. Countries such as the United Kingdom, Canada, and parts of Scandinavia adopt more selective screening practices for older adults. Physicians base recommendations on individualized assessment rather than standardized checklists. Despite fewer interventions, outcomes for older adults in these systems are often comparable or superior to outcomes in countries with more aggressive screening. This evidence suggests that thoughtful, personalized care, not more testing, is key to promoting longevity and well-being. Actionable strategies for older adults become clear from this discussion. Avoiding unnecessary tests is only part of the picture. Equally important are daily habits that enhance cardiovascular health, mobility, and cognitive function. Moderate, consistent physical activity, including walking, light resistance exercises, and flexibility routines, has a profound impact on independence and vitality. Balanced, nutrient-dense nutrition supports muscle mass, cardiovascular function, and cognitive health, while adequate hydration is essential for overall wellness. Sleep, social engagement, and a sense of purpose further strengthen resilience and quality of life. These foundational practices often yield benefits far beyond what invasive tests can provide. Finally, thoughtful use of natural supports can complement these habits. Compounds such as watermelon extract, rich in L-citrulline, may enhance circulation and support heart health. Targeted senior vitality formulations combining vitamins, minerals, and plant compounds can provide additional support for energy, immunity, and overall wellness. While supplements are not substitutes for healthy routines, they can serve as valuable adjuncts when used strategically and under professional guidance. The overarching principle is clear. Health is defined not by the number of tests or procedures performed, but by the quality of daily choices, the awareness brought to medical decisions, and the intentional cultivation of habits that support independence and well-being. By asking the right questions, evaluating risks and benefits in context, and prioritizing what truly matters, older adults can maintain control over their healthcare journey, minimize unnecessary harm, and maximize quality of life for years to come.